to the Primetime COVID Command Center. We're going to be tracking this variant and our movements all the way through, better or worse. And we start the week with good news. There's been a steady rise in the pace of vaccinations recently. Take a look at your screen, especially in states that had been lagging the most. Now, that's the best part of it, okay? The states lagging most are stepping it up the most. Great. 7-day daily average of new people getting vaccinated is over 400,000 in the last week. But we're paying the price for waiting so long. Deaths have increased more than 25% in the last 7 days. That's not going to stop anytime soon. The average daily count of new cases up 44%. Not going to stop. The one to watch, hospitalizations. Okay? Remember, capacity. Do we have the capacity? It's going to be a big theme tonight. A lot of people in the healthcare sector are very worried with this 41% rise week over week because they don't have the beds. The 5 states faring the worst with the most new cases per capita, all in the southeast. Alabama, Arkansas, Florida, Mississippi, Louisiana. Louisiana expects to reach its highest level of hospitalizations in the pandemic tomorrow. Okay? They are up 189% in the last 2 weeks. 11,000 new cases over the weekend. Almost 2,000 hospitalized. That's their biggest concern. We have the governor coming up. 1 in 5 new cases in America, however, 20% in Florida. Last time I checked, not 20% of the population. So they are outgrowing in terms of cases. Why? Florida broke 21,000 new cases on Friday, the state's highest one-day total since the start of the pandemic. Think about that. All 3 variants are competing in Florida. That state is the first to see 4 strains of the virus thrive. Again, why? Take a look at the reality. Miami Beach this morning, a year and a half into the pandemic. You know what that is? A line to get tested. They're waiting to get tested because they're freaking out. There are cases all over the place. Hospitals in South Florida are filling up with a record-breaking number of patients. This is August 2021. We should not be here. We shouldn't have been there the first time. We certainly shouldn't be there again. And also, every state is going to be an examination of leadership when you have bad numbers. The big-name leaders aren't exactly owning the situation there. You got Republican Governor Ron DeSantis. He's the one who started the Don't Fauci Florida campaign. Now you got this pop in cases. You're going to be held to account. All right? You needed people to get vaccinated. You made a mockery of the man behind the vaccine. Now here you are. Then he barred schools in his state from mandating that children wear masks. Will that be seen as a smart move by the people there? And as things go the wrong way, he's been on his way out of state, fundraising. It's time to stay home, especially when you have guys like this. Not DeSantis, he's the governor. This guy, filling the void, the top RNC official in Florida. This guy, he's been comparing the Biden administration's vaccine efforts to Nazi-era brown shirts. I mean, come on with this crap. Our friends at K-File found this. Peter Feeman is the guy's name. On his blog the other week, he wrote stupidly, the Biden brown shirts are beginning to show up at private homes questioning vaccine papers. Look, not only is it not true, I mean, when are they going to stop with this type of just ugliness? And when will DeSantis, because this is his state, but Republicans in general and leadership, not just say, I don't agree with that, not just say that's wrong, say, he shouldn't say it. Shut up, Feeman. That's what they should be saying. We need to hear it. Now, and it's not one and done with this guy either. In May, he called vaccines a mark of the beast, and it wasn't a throwaway. He was making a reference to a symbol from the biblical book of Revelations showing allegiance to Satan. How do you know? Thursday, he attacked the CDC for its new mask guidance for the vaccinated, and here was his language. Quote, the wolves want control and power. As for me and my house, we will fight them. Look, on one level, there is no cure for what ails this guy. But some of the misinformation is opportunistic. And that opportunity was provided by the CDC. Now listen to me for a second, all right? We need data so there is less room for toxic spin. You say we're changing masks and you don't tell people why. You're opening yourself up to this opportunistic spin. Not this brown shirt BS that this guy was saying, but just people questioning it, okay? Now that we're all worried about the vaccinated getting the variant, what the new word in our vocabulary, right? Breakthrough cases. We need to know the numbers. They should have come out with the numbers right away, if they have them. This is part of the problem. Is there a pure count nationwide of the number of breakthrough cases vaccinated who get sick? I don't think so. But the CDC does say more than 99.99% of the fully vaccinated have not had a breakthrough case resulting in hospitalization or death. Okay, that's what the vaccine's supposed to do. Keep you from dying if you get this virus. But hospitalization and death isn't everything. Cases matter too, and it must matter to the CDC, right? Because they jumped on the Cape Cod cluster. There were only a few severe cases, but there was a lot of sickness. They changed their guidance after that. So clearly, cases matter no matter the severity. Give us the numbers. According to new research from Kaiser Family Foundation, January to July, the rate of breakthrough cases, again, vaccinated who get sick, of any kind, reported to states is below 1%. Raises a question for me, maybe for you. Is the reporting sufficient? How does it work? How many people are getting these viruses don't know they have it? And yet, the information that matters most is the messaging that removes hesitancy about the vax. Now, distinguish between hesitancy and resistance, right? Too much of the resistance is either being an anti-vaxxer, forget it, or I'm not doing it because it's a show of strength. That's going to be tough to fix also. Hesitancy you can, and we have a new bold-faced name making the pitch, Senator Lindsey Graham. He announced today he has a breakthrough COVID case. He says he started having flu-like symptoms on Saturday, but he added, quote, I'm very glad I was vaccinated, because without the vaccination, I'm certain I would not feel as well as I do now. My symptoms would be far worse. And he's right. That's what the science says. That is the key. Good for him for reminding Americans of that. Wish him well. Good for him for taking the chance to push getting protected. So where do things go from here? Let's bring in a better mind.